Hi, greetings everybody. Good morning, good afternoon, good evening, depending on where you're joining from. Welcome to the webinar. We're just waiting for a couple minutes to have other attendees join in as well, and then we'll get started. Thank you for making the time and coming on to the webinar. And we already have all of our panelists here today. Once we have other attendees in as well, I'll go ahead with the introductions and get this started. Thank you for joining in. My name is Shubham Grover. I am the growth and insights lead for Nivi. I'm based out of India. Nivi is a digital health company that was founded in 2016 that focuses on providing on-demand, trusted, and actionable health information and enables individuals to make informed choices about their health. Companies like MSD, PSI, Population Council, 90 Innovation, Ark Venture Studio, TATA VNMG are some of the leading organizations that use Nivi to reach, engage, and serve health consumers in a variety of therapeutic areas. So I'll be your MC for today's session. We're thrilled to have participants coming in from the social sector, from pharma companies, from peer companies, and other public health organizations. That kind of showcases the diverse interest in our topic today. Moving on, we're going to do a deep dive into a real-world case study from Nivi and its partners from the work in Kenya around raising HPV and cervical cancer awareness. And we're going to talk about how, along with the partners, we've built an innovative financing solution that covers the HPV vaccine as well as preventative screening services for female cancers. Our goal for the webinar is to share our learnings and insights that we feel will help drive cervical cancer elimination in practicality. And even beyond that, we want to demonstrate how and why we've come to a solution that can nearly be applied across all therapeutic categories where accessibility poses a challenge to improve health outcomes. So I encourage you to use the Q&A section as we move along the different sessions of the webinar. You can ask your questions to our guest experts here, and we have some time dedicated near the end to do the Q&A to take these questions up with them. Moving on to just introducing our speakers, I'll do this in the manner we have the sessions organized as well. Starting off, we have Sid Goyal, who is the co-founder and CEO of Nivi. Sid's based out of the US, and he's joining us early in his morning in the US. We also have Ben joining in, who's also co-founder and the chief business officer at Nivi. Ben's also joining us from Boston. We have Priya as well as Anaga, our colleagues based out of India here on the webinar as well. In the guests, we have Dr. Ratna Devi, who's the CEO of Dakshama Health. She's a medical doctor, a public health management professional, and brings about 30 years of experience working to improve health outcomes here in India. Dr. Ratna's organization is dedicated to working and making health accessible, as well as her organization works in patient education and advocacy. Dakshama Health aims to create a network of caregivers and patient groups and works with them on knowledge sharing as well as providing essential feedback for managing health issues and diseases. As a strong patient safety advocate, she works with the government as well as with patient organizations to advocate for efforts that will improve health outcomes for the populations. Welcome, Dr. Ratna. For the attendees, Dr. Ratna will be having a conversation with Ben on uniting efforts for change. What's the role of different stakeholders regarding the topic of the webinar today? Next up, we have Yusuf. Yusuf joined Merck Sharp and Dome MSD in 2017 as the Access Director for South Africa and Sub-Saharan Africa. In 2020, Yusuf joined the Global Access Organization at MSD as the Solution Director in the Global Affordability and Sustainable Access Solutions team. Yusuf's team's mission is to enable solutions and collaborate with the ecosystem partners to deliver sustainable access to medicines and vaccines for people around the world. That's Yusuf's introduction. Yusuf will be having a chat with Sid on why he prefers using real-world data to inform his market access strategies across his target geographies. Welcome to the webinar, Yusuf. We also have Bart and Stephen joining us from Ark Venture Studio. Stephen co-leads the Ubuntu venture as a consultant within the Ark Venture Studio. His key focus is to create, design, and operationalize the Ubuntu product portfolio, aiming to grow access to wellness and insurance for low and middle income countries in emerging markets. Stephen has more than 10 years of experience in insurance and about 16 years of experience in the tech sector as well. He has a track record of successfully transforming and leading businesses through sustained and rapid growth. Talking about Bart is a dynamic leader and consultant at the forefront of innovation in global healthcare and insurance sector. As the co-leader of Ubuntu within the Ark Venture Studio, Bart is dedicated to expanding access to wellness and insurance solutions for the underserved communities in emerging markets. Welcome to you too, Bart. Great having both of you here. We also have Anshul. Anshul and I will be chatting about youth-centric approaches for the digital era, for navigating health and wellness, and how to reach out to the youth of the country. Anshul is actually a social entrepreneur and the founder of Youth Ki Awaaz, India's largest platform that uses polling, surveys, and storytelling to transform youth voices into actionable insights for social and behavioral transformation. Anshul is actually also an Ashoka Fellow for Social Entrepreneurship and was named a Young Innovator by United Nations ITU. He was also named a Forbes 30 Under 30 Media Influencer in 2018. So thank you for joining us for the webinar, Anshul. Happy to have you here. Let's quickly go over what we will cover today. We're going to be talking to Dr. Ratna about why does the fight against cervical cancer requires united efforts? What role do stakeholders play? We'll have Yusuf talk about why does MSD use real-world data to inform market access strategies? We have Bart and Stephen, whom we're going to ask, why did Ark Venture Studio create a new insurance model to promote health and wellness? And last up, like I said, we have Anshul. We'll go with Anshul and explore what are youth-centric approaches that we can take in the digital era to promote health and wellness amongst the youth. We expect the presentation to last about 45 to 50 minutes, and then we have some time remaining at the end for Q&A. I'd like to tell you all that the webinar is being recorded, so all the recording will be made available to all the participants after the event. So I guess all the housekeeping apart, now is the time to kick it off. I do have one thing that I'd like to request you all before I kick this off. I have an idea which I think makes a good starting point for the conversation. We have a 5-question quiz on HPV and cervical cancer that we'd like you to take to test out your knowledge on HPV and cervical cancer. You can actually scan the QR code that's visible to you on the screen. It's going to redirect to Ask Nivi on WhatsApp. That's our digital health chatbot. And you're going to see the pre-typed message that I have in quotes here. All you have to do is send that pre-typed message, complete a quick onboarding, and attempt the 5-question quiz as we get started with the webinar. Please make sure to attend all the 5 questions, and I promise to share results after the webinar is over. These results will be anonymized, but would also reflect how this participant cohort has done on the HPV quiz. Let's dive into today's session. Ben, Dr. Ratna, I'd like to call you folks on the floor. Please, let's get started.
Great. Shubham, thank you for the intro, and I appreciate having the WhatsApp quiz. Dr. Ratna, thank you for joining us today. It's great to have you here.
Thank you, Ben, and thank you, Shubham. Sorry. Thank you, Ben, and thank you, Shubham, for that kind introduction.
Fantastic. Well, great, and great to have you here. So I wanted to be able to set the stage and set today's conversation really around contextualizing the landscape. Give us a sense of the magnitude of the challenge we see before us. And if you could, recognizing that cervical cancer is one of the leading causes of death globally for women of reproductive age, that the burden of disease is significant in emerging markets and frankly, in many parts of the world. If you could just speak to the gravity, the significance of the challenge ahead, and give us a sense of why this is important.
Thank you, Ben. A very important question. And we know that globally cancer rates are rising every year, and so more so in cervical cancer, which is a very preventable disease. And we know that there are around 500,000 cases annually and more than 300,000 deaths in women to something that is absolutely preventable. And this indeed is a cause for concern.
No, it is. It's a challenge, and from where you're working with government, with patients groups, with patients themselves, this is a significant challenge that these various groups face. Getting the vaccine into solutions in hand, then, could you speak a bit to the challenge around awareness, around speaking to different interest groups and seeing that solutions at hand are actually taken up?
Thank you. And awareness is a very big challenge, and it's not just the awareness, but also very low vaccination rates, which could be linked to awareness. So many people do not know that this is preventable and that early vaccination can prevent the disease, especially if you give it in young boys and girls.
Yep.
Also, late detection, because women do not report to doctors even though they have signs and symptoms. They do not know how to recognize that they may be at risk to cervical cancer, and therefore they do not report to doctors. There is low health literacy in many of the low and middle income countries, and even lower digital health literacy. So people do have access to mobile phones, but they are not familiar with using digital technology to be able to run simple checklists to know whether they are at risk or not. And while the HPV vaccine is included in many government schemes, people do not see the importance of getting themselves vaccinated and therefore do not turn up at clinics which offer these services. Also, when children visit pediatricians for other reasons, pediatricians themselves sometimes do not recommend the vaccine. So there is a low awareness across the spectrum from service providers to the mothers and children themselves.
Wow, that's a lot of challenges ahead. So there are challenges with low awareness, there are challenges with low screening rates. And then on top of that, there are these social or societal barriers, cultural barriers that could be playing a crucial role in both setting and stymieing or presenting the challenge, and then also blocking or presenting challenges and rolling out solutions. So with that, recognizing the various barriers, challenges at the individual kind of group level, there are roles for various stakeholders to address some of these challenges to improve the current situation. I was wondering if you could speak to the role of parents and the role of public sector here in addressing that low awareness, those low screening rates. What can we do as parents? What can government do to ameliorate the situation?
Thank you, Ben. And again, a very, very important question, especially in the context of low and middle income countries where there are gender disparities in access to healthcare. So traditionally, women and young children who are girls do not really get the same level of access as boys and men do. Also, there is a lot of taboos and stigmas, as well as myths and misconceptions around women's health, which prevents mothers taking their children to, say, a pediatrician or a gynecologist for vaccination or even for a routine checkup. Given this, I think parents have a very big role to play with the right kind of awareness programs on the importance of prevention measures through easy uptake of vaccination, which is available so easily within the government systems these days. And all they need to do is to make an appointment and get the vaccination. As for the government, the vaccination has to be made available. There has to be information on where these vaccination centers are so that people are not searching around for those centers, and it could be part of a routine immunization program. So when you go for other vaccines, you're also advised the HPV vaccine. In terms of hospitals, I think the healthcare providers that children and women visit need to be able to advise them to take those vaccines. So even if it's a routine visit for a fever, I think the checklist should include, are you vaccinated for HPV? And if they are not, then they should be advised for that vaccination. In terms of manufacturers, they should be able to provide vaccine at available costs. And then, of course, there's all other stakeholders like the insurance, the technology, etc., that can add value to all these stakeholders who are making the environment more friendly for vaccine uptake.
You've kind of anticipated my next question, mentioning private actors in the private sector. I think, but I first want to acknowledge, as a parent myself, what you're saying resonates certainly on the role of parents, of caregivers, in actively taking children for routine vaccination at that critical age where they're age eligible for the vaccine. And that's addressing a certain segment. This works certainly in the public health system, making it readily available. But there's a role here in the private sector, and you alluded to that in your comments here. And I was wondering if you could expand on that, thinking about other age eligible cohorts of vaccine eligible individuals. What's the role of private sector in catching up and addressing the needs of young people around access to the vaccine?
Young people these days, and they always have been very, very curious. So they are always searching the net for information. I think one of the largest roles that the private sector can play is to make that information accessible through easily available platforms, so that girls or boys or even older women and men who are searching for this kind of information are not searching websites that are not providing accurate information. Also, once that information is available, it should be in an easily readable and understandable format, maybe through an app or through using mobile technology or social media, for example, because these are some of the platforms that the large masses access. Creating those platforms that are easily accessible could be another way, using chatbots, for example, because many people are asking questions and searching the web using those questions. So if there could be a question bank that one can curate from some of those searches that young people are making or even other people are making, and then you create a chatbot so that those questions are answered, then people are not wasting time or not going to sites that are not authentic, and not going to places that are not offering them the right kind of healthcare.
Those are great points, and I'm glad you brought up digital. It's certainly it has a role in being present where and when people need the information. And it's not simply a matter of searching for information, but also then generating results that are meaningful, high quality, and actionable for users. So I thank you for raising those points. It does feel like the future is digital. Now,
If I can just add one more
yeah.
point, Ben, I think a lot of times there's information available, but not in a format that could be understood. So, for example, local context, and diseases are referred to in local languages or local contexts, and those kind of language barriers can be overcome through the private sector. We could use technology like the QR code that we just had to be able to redirect people to a particular website where you can choose what you want to see and then run a questionnaire to see whether you are at risk for a certain kind of cancer, in this case, cervical cancer. And if you check a few points, what do you do to eliminate that risk, or where do you go? Who is your healthcare provider who can help you? What kind of specialty deals with this kind of thing? All this information can be provided in very easily available formats. However, nothing of that kind exists. There is a lot of information, but it's all very fragmented. It's not in one platform. So a single platform that provides this kind of information would be extremely useful.
Oh, fantastic. I think those are great remarks, and it does help set the stage, both the magnitude of the challenge ahead of us and the potential, the promise of various solutions coming together in a more coordinated fashion in a digital ecosystem. I really thank you for those remarks. I think,
Thank you.
Shubham, over to you. This helps sets the stage for some of the following conversations here.
Thank you.
Absolutely,
Thank
Ben.
you.
Thank you. Thank you, Dr. Ratna. Thank you,
Thank you,
Ben.
Dr.
That was an insightful conversation. I think what I'm taking away from your chat is being present and being able to meet young people where they are is probably the only way to actually make a difference. And I think it would definitely help enhance some of the other topics that we're now going to talk about as well. Uh, I think, picking up on your conversation specifically about accessibility, I think that leads us to Sid and Yusuf, your conversation. I would like both of you to please unmute yourselves, and I'd put the spotlight on you for you to get started.
Thanks, Shubham. Yusuf, great to chat again. We've had many conversations over the years. And thanks, Dr. Ratna, for setting the stage for this conversation. I think she highlighted a lot of challenges that exist in this space, from awareness to the link to importance to accessibility of information. Given the scale of these challenges, what, are we doing enough? Do you think we're doing enough? And if so, or if not, what do we need to do?
Uh, well said, you don't start with easy questions, but what I just want to do is first acknowledge Dr. Ratna and a lot of the elements that she covered. Specifically two things that resonated with me is speaking to individuals in the language that they understand and making a journey easy for people so they know which facilities to go to. Think of it, you could make everything for free, but if they're not understanding what you're saying and if they don't know where to go, you might as well be doing nothing, right? So this resonates across all healthcare ecosystems. But back to your question, Sid, I mean, it's like asking how long is a piece of string, and it's quite complex. So I'll answer that question later. And we need to commend healthcare systems right now. I think within what you find in national immunization programs, they have to put their resources where they can get the best bang for buck. So they have really small cohorts. And if you think of many national immunization programs, let's just talk from an HPV perspective. If there's a vaccination program, many countries have a vaccination program, probably, and I'm talking resource constraint environments, for girls 9 till 12, 9 till 13 years of age. Now that's great because that's where you get most return of investment for your intervention. But here's some questions we need to think of, right? In order from vaccines, how it works is you want to achieve herd immunity. And to achieve herd immunity, you need to reach many more people. So, Sid, let me ask a question to you. What happens if in a particular country there is an individual when NIP exists and they are not 9 till 13? Let's say they are 16. What do they do?
It's unclear. I mean, I think that's the big challenge, is what do I do? And that's the open question that maybe many people have, is where do I go?
Yeah.
And I think that's where sometimes, too often, the conversation starts and stops. And I'm sure that you've seen that from your perspective. And so, in that context, what do we
Yeah.
do?
So, right. So here's other questions. Let's say you are not part of the cohort. What do you do?
Mhm,
What happens if you were born at the wrong time of when, just a different date? So
mhm,
you were not born when the vaccine was available. You are now an adult female. You're working. You can't get it through the NIP. What happens if you are male, right? 30% of males are actually carriers of the HPV virus. What
mhm,
happens to that? 20% of those males carry the oncogenic virus, right? So we need to think of this as a holistic solution. And if we look at this, now let's dig into some of the details and the numbers. Let's take a cohort of females in Kenya, 19 till 30 years of age. And in this 19 to 30 years of age, there's 5.5 million females from 19 till 30, right? Who's potentially a cohort we're not even looking at.
mhm,
And people say, oh, wow, affordability is a challenge.
mhm,
But of those 5.5 million people, 2.5 million of that specific cohort actually own iPhones. Now,
mhm,
I think if you can own an iPhone, you can afford to get a vaccine, right? So it's the willingness to pay. But what is the barrier behind that? The barrier behind it is, do they have enough information to go and make a decision around vaccinations? So this is now where you think of, okay, brilliant. There is this cohort of individuals who's there. The NIP focuses on a very specific cohort, but this is a ripe opportunity for something that we would call public-private partnerships.
mhm,
And there's very
mhm.
different things that you can do. So, in answering your question, how long is a piece of string, Sid? It's twice as long as half of its length.
Yeah, yeah, yeah. So where do we go from here? What's the next step? Or what's the gap that exists to getting to that new cohort? What questions do we need to answer?
Yeah. I mean, that's so important, right? And I think it's this data element is consistently coming behind. We've just, in this cohort that I'm telling you, we've identified, okay, there potentially is no barrier to affordability. But what are the elements that will resonate with those individuals? We don't know. We, for example, in that cohort in Kenya, and this is through the work that we've done with Nivi, we had no idea of what resonates with them. Where are they getting their information from? How do they consume media and information? Do they resonate with the messages that's coming along? In the affordability spectrum, how do they consume healthcare? Where are the clinics that they're going to? There's so many different questions that we could not answer. And I think this is where, the Nivi data set was extremely important in answering some of those questions. So what did it do for us? It allowed us to start making data-driven decisions. It allowed us to pursue different avenues of interventions that we knew would resonate with particular target audience. And I think this is also quite interesting because at the time we have many different things going on. One of the elements that we always see moving forward is health-seeking behavior. And this is what you're finding right now is a lot of people want to live healthier lives. And if you take this idea of health-seeking behavior, how do you transform that into something which is quite innovative? And I'm not going to talk about, the partnership, particularly with regards to Ark, because my Ark colleagues will go into that. But it's interesting because now you take this concept of health-seeking behavior from a market-creating innovation perspective. So you're able to, what we need to do is to take complex and expensive products and services and you make them and put them into a very simple, affordable product. But what you do by doing this is you start making it more accessible to an entire new segment of population in a society, right? So whom we would normally call non-consumers. And what this does essentially is this builds an ecosystem. So this ecosystem building approach means that you move away from a particular product and now you start building the ecosystem in the healthcare. And this means that if you solve for one product, you efficiently solve for access of multiple products. So in context of what we were doing in Kenya, there's different elements. When I think of employee groups, what they're looking at right now is how do we use health-seeking behavior around loyalty programs to retain our employees? And we started building things around that. From financial services, we could partner with them on different elements. And in the insurance space, it allowed us to work with Ark to develop a really novel, innovative product that allowed not only a benefit of catastrophic behavior, but you used health-seeking behavior from an intervention, so you ensure people have good outcomes at the end of the day.
Yeah, and you're getting at this point of ecosystem building, and I think underlying that is this idea of sustainability. What does that mean to you? What are the elements of sustainable and accessible in your context? And I think that will set the stage for our conversation with Ark.
And that's a very important point, right? And I have this, and this is my personal opinion, is in order for something to be sustainable, it needs to be embedded. An idea needs to be embedded into a country's working. And that means that we can't really rely on donor funding to, for any kind of intervention. Because if you think of it, donor funding will never, there's an end to it at some point in time. Even if we talk about Gavi funding for countries, at some point in time, countries need to graduate from Gavi.
Right.
So the best way for sustainability is to ensure that this becomes part of people's behavior and their day-to-day interactions. And it's okay. It's okay for private companies to be involved. It's okay for companies to make a profit. There's nothing bad in it, right? Because if companies are making profit, it means they can sustain themselves.
Yeah.
They can take that funds, reinvest it, build a bigger ecosystem, and it becomes greater than what we focused on. So, having different companies, having different partners come together to solve for a problem in a sustainable way, where individuals are making profit, is fine, but we need to do it without the expense of patients and affordability, and it needs to be done in a smart way that we can target these consumers and really provide benefit to them. So at the end of the day, design from the outside in, so we provide what's best for our populations.
Yeah, yeah. And I think that sets the stage for our conversation with Ark. And, in the context of Kenya specifically, what were the elements of sustainability that you saw based off of the work that we did together?
So one of the things that we looked at was, firstly, how do we reach these target consumers, right? So what is a mechanism of just making them aware of a healthcare intervention?
Mm-hmm.
The other element was, if we had to build a particular product, how could we make it cost effective? So how do we price a product in an avenue that's available to majority of the population? When a lot of people think of just like from an insurance product perspective, you want to price something, you start charging $50, right? That already puts you in the context of a low income country like Kenya. It puts you on that upper echelon. You're only reaching 5 to maximum 15% of their population at max. But majority of the population are in the
Yep.
middle segment. So what do you need to do to reach that middle segment? It's around, how do you find an innovative way to price a product between $1 to $10? And for that $1 to $10, you are also providing people benefit, right? So they don't feel like it's an expense. It becomes part of their normal daily behavior. And this becomes an ecosystem approach. And if they want, they make decisions around healthcare and screening, which ultimately means better health outcomes for them. And this talks to sustainability, right? Because
Yeah.
it's, people need to know, I firstly can afford it, I know where to go to get it, and lastly, I know my benefits. So if I have a benefit, I actually know what I have and how to draw on those benefits. Many health insurers around the world have such complex benefits out there. People don't know where to go, right? They don't know the start, they don't know the end point, so they don't use it. And at the end of the day, a lot of the initial work around screening, vaccination is lost. And then you have this catastrophic event.
Yep. So that's great. And I think that really sets the stage for, the conversation with Bart and Stephen at Ark. I know you were instrumental in bringing them into the ecosystem. And I think maybe in conclusion, what was it about Ark that sort of interested you in bringing them into this ecosystem?
So this was a really, I think, an interesting culmination of meeting of minds. We were working with Ark on a different end. And by the way, I mean, I'm looking at Stephen, discussions we've had with Stephen went even before Ark was formed, right? But we always were thinking of, what was a mechanism to put together a female health product that provided the best elements that resonated with females, but also addressed needs on a catastrophic event if it had to happen. But what we wanted to do is to make sure that it was affordable and sustainable so that we could reach populations. So as we were moving along this journey and having discussions with Ark, it wasn't even Ark at the time before it was formed, that was the discussion and the journey we were on. And, we were having discussions with Nivi in terms of what is this target cohort and population. And I found myself in an amazing situation where I could take two amazing companies and just join the dots. And I think this is what we need to learn. So learning for me is, you don't need to be the magic, right? You just need to be the connector. You need to know who's solving a problem. Who are the other companies that have a problem? How do you connect them? And the magic can happen. And I mean, Stephen will talk about the product that they've developed and launched. And I mean, that was really a culmination of minds, but it was really also an innovative mindset and individuals who were singularly focused of, how can we do good for a country and do better by its people.
Yeah, great. Well, thanks, Yusuf. And I think that's a good segue into my conversation with Bart and Stephen. Bart and Stephen, thanks for being here again. It'd be great to hear more about Ark and kind of, your perspectives. Where does Ark come from? What was the genesis of the Ark model, and we can start from there.
Okay, happy to start, and thank you to the previous panelists of setting the stage so well on such an important topic. And I think a lot of what we say will actually will be reflections on some of the points that were already made. But to answer your question, Sid, so Ark Venture Studio is an initiative by Nivi. Nivi are innovation consultants based out of London with a very specific focus on the insurance industry. And they have basically designed and set up Ark Venture Studios some time ago with the ambition to create new companies, which are all designed to tackle in some shape or form some of the big systemic risks to people and planet. So there's a very clear alignment with the United Nations Sustainability Development Goals there. And besides topics like climate vulnerability and poverty traps, one of the big focus areas that they have is health and wellness. And how can we provide better access to healthcare to underserved populations? And so this is exactly where Ubuntu, which is the topic of today, so where Ubuntu comes into play. So Ubuntu basically is a venture of Ark that was established now a little bit over a year ago, with the high-level vision to provide better access to healthcare to that missing middle in LMICs, in emerging economies. And sort of the philosophy that we have around that is that we observe that in these emerging economies, too often individuals are still struggling to get access to the right level of care, to get access to prevention services in particular, to get access to products that actually make sense. Yusuf was talking about BMI products, $50 and above, which are not affordable for the cohort that we are focused on. So how can we design new, simple, affordable products for that cohort in particular? And so that's what Ubuntu is all about. In that philosophy, we want to be very disease state focused when we are designing these new innovative products and these new innovative solutions. And so this is where cervical cancer comes into play. So we wanted to make sure that for our very first product, because we have wider ambitions, but for our very first product, we target on something which has, on the one hand, which represents a big burden to society in general, but also which represents an opportunity to really create impact. And so this is where we ended up with female cancers more broadly and cervical cancer then in particular, because it is a burning platform. It is still a great driver for mortality, not just in emerging economies, but I guess globally, but disproportionately, I would say, in emerging economies. So it's a burning platform, but there is also a unique opportunity. Cervical cancer is one of the best preventable and treatable cancers that are out there. And if you look at Kenya in particular, we noticed that 80% of cancers are diagnosed at stage 3 or 4, which is basically when it's almost too late. We know that more than 40% of individuals cannot actually complete cancer treatments because of the lack of financial means, not just to cover the treatment, but also some other out-of-pocket expenses. So also through our product design, we wanted to make sure that we create impact and we tackle those issues. So that's where how Ark Venture as a high-level entity has a very specific interest in cervical cancer and helping the elimination of it.
Yeah, and why Kenya? What you mentioned some of the statistics around Kenya in particular, but you might see similar statistics globally. What was it about Kenya that attracted you to that market to begin with on this journey?
Yeah, so if you don't mind, Sid, I'll
of course, please.
And going back to Dr. Ratner and Yusuf as well, some really important points that are not necessarily Kenya specific, but they're global in nature. But when you're starting with an idea, a concept, and wanting to make it reality, you've got to start somewhere. So we felt with the people that we had around us within the Ark Venture Studio. A number of us had quite a lot of experience in sub-Saharan Africa, as well as Southeast Asia. But we had a lot of fairly close relationships within some of the ecosystem partners within Kenya. So we thought, okay, well, if we're going to do this, we need to get something to market pretty quickly. And we had a lot of the ecosystem relationships already built up. So we thought, okay, well, we'll start there. We'll test it out. We'll take concept to reality, see how it's performing, and then we want to go global. Not only with the longer term vision for Ubuntu isn't just as Bart said, just on female cancers. We want to develop this kind of prevention, education, and also insurance protection, so wellness prevention and protection across other disease states. So we're looking at kind of maybe other cancer products that you can kind of test for as well. But we need to start somewhere. And that's where we got to within Kenya. So we took this design in January 2023, so just over a year ago, and then built the ecosystem partnership. So we built partnerships with an insurance company called APA. We built partnerships with the healthcare providers. We built partnerships, obviously, with yourselves as Nivi to build an engagement tool. And it was really to address, as Bart said, the problem statement, which is women who are diagnosed with both breast and cervical cancer. The mortality rates are just dreadful, just in terms of the percentages. So we wanted to change that dynamic. So we wanted to create a solution that addressed both the issue of affordability of treatment, because many women that get diagnosed with cancer cannot afford the treatment associated with that, especially with some of the really innovative immuno-oncology treatments available. But we also wanted to change the dynamic of screening and vaccination. So we wanted to address the prevention element. So we put a product together, you may have seen on the screen, that has access to screenings for both breast and cervical cancer. It has access to vaccines, and it also has an insurance payment that is large enough per stage of diagnosis and treatment that actually enables that to happen. In addition, we believe that the coverage levels are actually in excess of some of the treatment costs that would then go towards addressing one of the key issues, which is out-of-pocket expenses. So these are incidentals like getting to the hospital, getting to screenings, overnight accommodation, loss of income, kind of things like that. So that's where we got to, and I think one of the really important elements, going back to Dr. Ratner, was about education and awareness, which is where the chatbot element comes in, because when someone avails themselves of this product, they then get enrolled into the chatbot conversation through WhatsApp, which then enables them to learn more about screenings, about vaccinations, to kind of debunk some of those myths, to increase their awareness, but also to reduce some of the frictions. So developing automated appointment booking through that chatbot. So we wanted to try and reduce the elements of friction associated with those customer journeys, give availability to clinics that are close by that can do the screenings, and just kind of remove some of those barriers.
Yeah, and I think that is one of the how did you design for affordability and also account for wellness, prevention, and treatment? What was, 1 year is a really short period of time to get, such a complex product up in the market and launched, especially with all the ecosystem partners that you mentioned. What was the sort of the driving force behind being able to do that so rapidly?
Yeah, so I think it's, I mean, Bart can talk to it probably a little bit more, but it is about the collaboration between all of the partnerships. It's making sure everyone's aligned on the same vision and just driving towards that. Bart, have you got any comments on that?
Yeah, no, I was going to say the same, and Yusuf mentioned something in that regard as well. You can individually all have great stuff to offer, but in the end, it's about bringing that together in a coordinated fashion. And I think that's also what allowed us to move really quickly and indeed build and launch a product in less than a year. So it's thanks to that partnership model that we have developed by bringing pharma industry together with the insurance industry, but also locally embedding ourselves within that ecosystem, because that's ultimately what will also make or break this product. You need to make sure that you're embedded within the ecosystem, that you remove barriers as much as you can for people to then actually also access all of these services, not just buy a product, but actually use the product and avail of the services in it. But in essence, it's indeed about coordinating and partnering with all of the different players in that ecosystem.
Yeah, and so, you mentioned the ambition to take this globally. What's next? Where do we go from here? How do we, take this model and scale it?
Yeah, well, what's next? I mean, first and foremost, we want to make sure that Kenya is a success. So that's our primary focus right now, and we see the first customers onboarding. So that's great to see. But having said that, we indeed have the ambition of expanding geographically. So take the model, take the learnings, take the validated assumptions from Kenya, and bring this to other places in the world who struggle with the same challenges of access and affordability. So take that concept, localize it in a new context, and roll it out in these geographies. But to Stephen's point as well, our ambitions go beyond that. We have a vision where we want to develop different types of products, which all have this component of awareness and education, prevention, and protection. And that could be about different types of cancer. Think about colorectal cancer, for example, but also maybe diseases like malaria, diabetes, etc. So over time, we want to develop a suite of products where we always bring back those essential components of prevention, awareness, and education, and protection.
Yeah, I think just to kind of bring it back to this kind of topic, our vision is to change the dynamic of female cancer in the countries that we operate. So where we have a certain percentage, be it 5% of Kenyans have breast screening, we want to change that dynamic. Where 15% of women have cervical screening, we want to change that dynamic. Where we have 80% of people being diagnosed in stage 3 and 4, we want to change that dynamic to 80% of people being diagnosed at stage 1. I mean, these are the visions that we have and that we're really passionate about.
And in to wrap things up, if you had to give one piece of advice to everybody here on a path forward, what's the key takeaway that you want everybody to walk away with?
But
you do save the difficult questions for last,
yes, exactly.
As opposed to what you said. Well, I'd like to come back to that collaboration model. I think the issue at hand is that large and is that big that I don't think any single entity, whether public or private, can solve for this. So I think the only way in which we can really have impact is by collaborating. And to Yusuf's point, I think collaboration doesn't necessarily mean that it's philanthropic in nature. So I think it's in the context of sustainability. I think there's a very strong argument for indeed creating companies that can also actually be profitable around this. But yeah, I think in essence, I think it's about putting our brains together for the benefit of patients and population in general.
Yeah.
Great.
I think my key takeaway is don't be scared of failure. So in order to move collectively everything forward, you need to try things out. You need to take something to market. You need to get the data. You need to learn. If it's not quite right, you need to pivot. So don't be scared of failure, and just really go for it and try.
Great. Well, thanks, Bart and Stephen. And I think that's a good segue into our final conversation between Shubham and Anshul, especially with respect to trying things out and collaboration. So I'll hand the floor back to you, Shubham.
Thank you, Sid. Thank you, Bart, Stephen, and Yusuf. And I think all of us wish all the success to the Ubuntu Venture, to Ark Venture Studio, for the initiative that you've taken on. Stephen, Bart, just to your point, I I recall a data point from the National Family Health Survey 5 from India. I think only 2.9% of the Indian population of like women between a certain age actually go for cervical cancer screening. So I hope after the success that you see in Kenya, India is on your list for future expansion plans as well. Moving on to Anshul, hi, good to
Hey,
have you.
wonderful.
You've
Delighted to
heard,
be here.
thank you. You've heard our speakers, other guests talk about the role of advocacy, the role of private sector. I see that you have a very unique vantage point here. Your platform Youth Ki Awaaz gets almost 25 million young readers every month. You have 160,000 people collaborating on user-generated content every month here in India. So from what I see, you kind of have your ears on the ground when it comes to the youth in the nation. I also know that you folks have recently launched an HPV quiz to engage the YK community, understand the knowledge levels around HPV, cervical cancer. I'd love to know what's the early data telling you? What does it look like?
Sure, sure. Thank you so much, Shubham. And before I start, I must say that uh, all of the speakers who've gone before me have sort of already covered, quite a bit of what I wanted to share. And I'm really happy about that. Especially what Dr. Ratna Devi said about, how we can use emerging technology to engage young people, or how Yusuf talked about the fact that so many people actually care a lot more about their health now than they did before. And I think that's what the data is also telling us, the preliminary data that we have. So just for everybody's context, I'm not a healthcare expert, but I am somebody who wants to create spaces for young people to engage with health related issues. And as a part of that, we launched this quiz. And of course, the initial information that we're getting is that people are extremely interested in finding out more about HPV, the vaccine. Having said that, barely 2 to 3% of the respondents who took the quiz were actually fully aware of everything to do with cervical cancer, or the vaccination. A majority of the people showed very average level of awareness. So we do know for a fact that while a lot of people are interested in finding out more, the current level of awareness is actually fairly low when it comes to the vaccination, or the primary causes of cervical cancer, for example. We noticed particularly in that area that just about 40% of the people knew how cervical cancer actually happens, and so on and so forth, what the primary causes are, and so on. And at the same time, we also noticed that a lot of women respondents aren't actually aware of the screening processes for cervical cancer. So, we're finding out a lot of data that I would say we already had an idea of. We already sort of knew that awareness levels are low, but now we have very hard data that gives us a very good opportunity to actually know exactly what are the areas where we need to engage with young people and what we need to talk to them about.
Okay, all right. Thanks, Anshul. That's helpful. So I guess what we're seeing here in India is somewhat similar to what Nivi MSD Ark Venture Studio also saw in Kenya when we started working around HPV and cervical cancer awareness. The awareness level for amongst the youth in India seems to be low, from what I heard from you. We're seeing more and more young people come online, right? I think we are in the digital era, and like Dr. Ratna and Ben also spoke about, I think being able to reach people where they are is going to make the difference. So from again, I ask from your point of view, what do you think are the steps that we need to take to actually reach the youth, raise their awareness, and drive uptake of preventive services from here on forward?
Yeah, I think so. Thank you for that question. And like I said, I think some of the tactics got covered when Dr. Ratna Devi mentioned about how we can use apps, how we can use chatbots, how we can use social media. So of course, the first step I think is sort of going to where young people already are, which is of course on social platforms, trying to see how we can engage cultural influencers who are already creating conversations around topics that young people care about, and getting their buy-in to the conversation. And I think one thing that I strongly believe in terms of the most important aspect here is that young people do actually care a lot about their health. What that basically means is that they're very interested in understanding how health has a direct impact on other aspects of their life, on their economic aspiration, on their livelihood, on their ability to go out and say migrate to places that they may want to live in the future, whatever aspirations they have. I think the conversation that we need to have needs to be intersectional to a degree where we are able to engage young people and help them understand how a higher level of awareness around cervical cancer can actually help them achieve their aspirations, how getting the vaccination on time can actually help them achieve their aspirations, because there's a very direct linkage with what young people want as an outcome in their life. So I think we need to hear a little bit from young people in terms of what are the things that they deeply care about. So maybe we need to do slightly more concentrated data efforts to really understand how do we get a better understanding of what young people's aspirations are, and then link it with their current healthcare challenges to try and see how we can create this conversation exactly where young people currently exist, be it on social media, be it offline, or through other channels that may be available to us.
Yeah, thank you. Thank you for that. I think that also ties into something that Yusuf was mentioning a little while ago. Understanding people's health seeking behaviors, understanding their aspirations with regards to their own health, and then I guess putting them on that behavior change journey where they're able to meet their health aspirations is kind of what you're also talking about as well. And I think we resonate with it.
Yeah.
Um, Thank you, Anshul. This was great. It's clear that platform like yours, like Youth Ki Awaaz, are playing a critical role in in shaping public opinion and shaping the opinion of the youth of the country and raising awareness amongst the young people. What I do like about Youth Ki Awaaz is the community building approach that you take towards raising awareness about critical issues, health and beyond. In fact, so thank you for coming on. I I do want to make
Thank you.
the announcement. I'm happy to say that we're partnering on the quiz as well as gathering these
Yes.
insights around the health-seeking behaviors of the youth, around their attitudes, around their willingness to pay for the vaccine, for preventive services, and also understanding their barriers to accessing these services. So I'm glad to announce that we are doing this together.
Yes. Can I
Thank you,
just
Anshul.
add something very
Sure.
quickly, Shubham? I think the community building aspect of it is really something that got Youth Ki Awaaz and Nivi together, because Nivi also has a phenomenal community of young people, across the country. And I think what I would just call out to the participants here is that this quiz and the link that Shubham shared, the survey and the quiz that we're running, they sort of are pretty much at the very initial phase of us trying to figure out how to engage young people at scale in the country. And we are really hoping that we can take this to a lot more people. So participants who are here, who are working in communities, who are working with young people already, we'd love to also get inputs from your side so we can strengthen the work that we're doing collaboratively, together.
Yeah, absolutely. I second that, Anshul. Thank you for the remarks. I could see we've had people going off in the chat wanting the QR code for the quiz that I'd mentioned at the start again. I just want to bring that up quickly. We also had I think we had a question coming in from Arundhati, and I could see, Ben, you've taken up the question in the chat. But just for everybody, Arundhati works with the Menstrual Health Action for Impact. It's an ecosystem enabler that leverages menstrual health as an entry point for women's health and well-being across the life course. Given that there are these programs which will get parents and young girls to the vaccination centers, how do we make sure that we leverage these health contacts with the health system to actually drive home points around holistic information, whether it concerns body literacy, concerns body agency, concerns information around sexual
I think
reproductive health
that's,
practices?
yeah, sorry. That's a great comment. I responded on in the Q&A. I think it's one of these things where it speaks to the purpose, the vision we have with Nivi and the partnerships you're seeing evident on the call today. And the sort of focus we have going forward is that by being relevant where and when people need information, where and when they need the support, that health companionship, that solidarity on a health priority of their own, one that they focused on themselves, we can be more relevant to more segments essentially, and be there more cost effectively. And so the vision, I certainly with the comment about the challenge you have, and it's a bit of a contradiction almost. There's a singular focus on HPV today, but someone may also have a singular priority on menstrual health and hygiene tomorrow. And so by providing the means to engage, those same tools that engage today can be useful and reapplied tomorrow, allows us to be present with partners you see here today on the panel and with others in the audience at different points in time, and to do so cost effectively as a solution day in and day out. So I don't see them as, I don't see the concern necessarily that was voiced there. I see it as an opportunity really to rethink about how we partner and to rethink how we structure our partnerships, looking for ways in which we can be relevant, certainly with Nivi, relevant to different health priorities across time is incredibly important. So I'm excited about the focus we have today, and I'm excited about the possibility of menstrual health and hygiene as a way in which we could amplify the reach of HPV awareness and vaccines. So I'll just park that there as like, whenever you see a contradiction, think about the opportunity here to find synergies or potential partnership.
Just
Thank you, Ben.
2 minutes. Yeah, so I would just flip the question around, and I mentioned this in the opening section, saying that vaccine should not be something that is seen as a vertical program, but every person who walks into a clinic, whether it's a child or an adult or a woman or a man, should be asked a question about vaccines as a screening question. So, even if you walk in with a fever or something else, which is very simple, like a routine blood pressure check, the physician should be able to ask you, are you vaccinated for these vaccines? And if they are not, then provide them with the information as to why that vaccine is necessary and how it will protect them. That will remove this whole focus on one particular vaccine and allow vaccines to be normalized, because usually life course vaccinations are not very welcome. Pediatric vaccines are more accepted because there is so much focus on that. Now, this vaccine sits across pediatric and adult, and that is where we want the conversation to go, not be limited to just young women or girls, but also to adults who need it. And therefore, this conversation around vaccine should be embedded into routine health checkups. And every person who walks into a clinic needs to be asked this question. So even if it's a man, you can ask the question, is your wife vaccinated for HPV? And if not, this is where she can get it, or this is how she can get the information about the vaccine. I think that's how we can build the trust around it.
Yeah. Thank you, Dr. Ratna. Thank you, Ben. So we have Dr. Tanvi Ahar from Tata Trusts here. Given that there's a global initiatives happening around introducing the vaccine into routine immunization programs, currently it's being perceived that the HPV vaccine is only for the girls. So it kind of leaves boys on the spectrum out there who may not fall into routine vaccination programs and thus may not get vaccinated at all. I think, Yusuf, you did cover some of the statistics around, the percentage of men that carry HPV virus, the percent of men then within that have the HPV virus, which is oncogenic as well. What are your thoughts on being able to create, and how do you think we should implement gender neutral vaccination programs across different markets?
I mean, Shivam, it's a good question. If you look at many high income markets, right, middle to high income markets, their vaccination programs are gender neutral vaccinations. So it's boys and girls 9 till 18 years of age, and even they have catch-up cohorts up until 26 years of age. And that's an important area to focus on, is because men are a carrier of the HPV virus, and the reason why we have this limited cohort in emerging markets is because it's a resource constrained environment. So they're trying to allocate their resources where they can have the most impact. But if you think of eradication of cervical cancer, and the Scottish government published, the Ministry of Health published data a month ago, where they are actually now able to eradicate the HPV virus, right? And that was because they had a complete strategy of boys and girls being vaccinated, as well as catch-up cohorts. It also means that not having a program is one part. Many markets have a program and their vaccine coverage rates are really low. You also need to have vaccine coverage rates of at least above 80%. And I think this element of people understanding what's available, the biggest root cause, the Dr. Ratha mentioned earlier on, is people just don't understand where to go. How do I get vaccinated? A lot of people don't even know that, this vaccine prevents you from not only cervical cancer, but many other cancers, anal, penile cancer, head and neck cancer. The data is evolving as we go forward. Education is becoming a central element and an efficient way to disseminate this information, not only on education, but around, just the simple logistics of where do you go, how do you get vaccinated, and speaking to them in a language that they understand are core foundational elements.
Yeah, couldn't have said it better. I think what we've spoken about this entire webinar about forging partnerships that actually enhance accessibility to the vaccine. I think it's going to help remove the gender disparities that exist in these in the vaccination programs today. And thank you for the inputs, Yusuf. I do realize we have some more questions coming in, folks. I would be happy to take these questions to our panelists here and get their responses to your questions. That brings me to the end. I do want to thank all of you. Thank you, Dr. Ratna, Yusuf, Bart, Stephen, Anshul, for your valuable time, your valuable insights, and the contribution to the webinar today. And a huge thank you to everyone who's joined as an attendee from various parts of the world. We've covered a wide array of topics from talking about the cervical cancer disease burden till the end of how do we actually take all our united efforts to the youth out there and actually make an impact through the public health strategies. It's what's clear to me is that collaboration across sectors and innovative approaches are essential while working towards eliminating cervical cancer and improving public health at large. Sid, I want to turn to you for any closing remarks, and then I think we can say bye.
Thank you. Once again, I'd like to thank everybody, Dr. Ratna, Yusuf, Bart, Stephen, Anshul, for being here. I'd like to thank all the attendees for listening in on this webinar. I hope you walked away with some key ideas on how we can work together to really tackle this global problem. I think one of the key themes that we are walking away with is that no one entity, no one organization, no one person is going to solve this challenge alone. And the power of partnership, both in the public and private sector, is going to be key to tackling this global disease burden. Thank you all again for being here, and look forward to connecting in the future.
Thank you, Sid.
Thanks, Sid.
Thank you, all of you.
Thank you. Thanks,
Wishing
everyone.
you all a great rest of the day. Take care. Bye-bye.
Bye-bye.